we're going to get into the system itself. So there are a couple of other new features in this system, which are nice for you as the user, we hope anyway. One is that, like I mentioned earlier, you have the ability to access incidents that have been previously submitted. To incident reporting, submitted reports, and you can see everything that was submitted over the weekend. You can sort by incident tracking ID, so you can put them in numerical order. You can sort by resident first or last name, so you can put them in alphabetical order. You can look at date and time submitted to MDH, so you can put them in ascending or descending order. So I want to see this is the most recent incident that's been reported on behalf of the facility, and it puts them in order, so you can see what happened over the weekend. All right, you also have the ability to save things as a draft. And so if you want to go back to a report that you had started working on, go to drafted reports, and these are all incidents that are in draft status. So I saved it, I want to go back to it and work on it. I click on the incident tracking ID, and it takes me to the already started drafted report. So if you notice now, the buttons that I see here are update incident, so that would actually resave the incident report. So if I click that, I'm going to get a note that says, oh, it's been successfully saved, and it's going to be saved for the next 24 hours, but deleted after that. So please ensure that you complete and submit this incident immediately. Okay, so every time you resave or update the incident, that 24-hour clock does restart. You also have the ability to delete the incident. So hit delete, and it says that it's been successfully removed from the system. Okay. Also with that drafted, we're recommending that you save early, save often when you're working on an incident report or a 5-day investigative report. You're inactive for more than 30 minutes, it will automatically log you out. So you want to make sure that you save everything before you walk away. And to show that something was saved, again, you want to verify that. You get a blue bar across the top that tells you that this incident has been successfully saved. And then you can proceed to log out. But make sure that you see that blue bar before you move away from the system. Okay? Also, when working with the system, you want to make sure that you use these menu options. Don't use your browser back button. Okay, using the back button could create a timeout, might cause some issues with the system itself. So you want to make sure that you use the menu functions when you're moving through the system. So anytime you want to get back to your welcome screen, click the home button, and it'll bring you back to that welcome landing page. On this welcome landing page, you'll notice that there's a link to the VA reporting requirements, and there's also a contact email for the Office of Health Facility Complaints. So this health.ohfc.nhrs email, that actually comes to my inbox. So I'm checking this daily to answer any technical questions people may have, or if you have any questions about the system or run into any issues, we are responding to those timely. Okay, so now incident reporting itself. So back to this incident reporting dropdown. So we've seen submitted reports, we've seen drafted reports. Say you just want to check on the status of a report. So you want to search incident reports. So if you go to search incident reports, it pulls up the full list of everything that's been reported in the system on your facility's behalf, and you can select the report status. So I'm looking for something that's drafted, something that's submitted, or say I want to look at closed incidents. So things that have been closed out, I've received my e-disposition for. So you're going to go to closed and hit search, and it'll pull up incidents that have been closed out in the system. And if you click on that incident tracking ID, if you notice, the e-disposition's been listed right at the top of the incident report summary page. So it's telling you that OHFC received a report of possible maltreatment, the information's been reviewed, and it's been determined that no further action is necessary at this time, okay? So it will add the e-disposition right to the top of that report after it's been closed out. Also in search incident reports, you can search by resident name. You can also search by this tracking ID number. And now the create report page. So you want to create an incident report, you want to report an initial, go to incident reporting, create report, and it's going to take you to this main page here. All right, so on the incident report screen, the first note at the top, anything marked with an asterisk is a required field, which means that we need you to fill in that information. There are also some other fields that are what we're calling conditional fields. So if you answer a question one way, we will ask you for additional information. So, for example, if you answer other to something, if other then what? Okay, so that would be a conditional field. Or when we get down to resident 1, has the resident been discharged? If they have, we want to know their discharge location. So there's some conditional fields where we'll ask you for additional information if you answer an above question one way or the other, okay? Also, again, the save as a draft option is there, and then the submit option is there as well, reminding you to save early, save often, okay? There's also a series of text boxes, what we're calling text areas, which are larger text boxes, check boxes, where anytime you come across a check box, checking the box equals a yes. Leaving the box blank would mean no. So if you check a box, it equates an answer of yes. If you leave that box blank, it means no. And then there's also a series of drop-down boxes. So you can select from a drop-down menu as opposed to typing in a field. So at the very top here, you're going to note that incident tracking ID number is 0, and it is 0 because you haven't saved as a draft or submitted to MDH, so a tracking ID number has not yet been assigned to this incident. Also, the incident status is in draft because you haven't yet submitted anything to MDH. The date and time submitted is empty because, again, nothing's been submitted. And then the incident is created by, your username will show up here, and then the facility name and health facility ID will also auto-populate at the top of the screen. So make sure that a date and time submitted and a tracking ID number, and then also this draft will change to submitted once the incident's been submitted to MDH. So I'm going to save it as a draft so you can see that it'll auto-populate. So it assigned it a tracking ID number, so it's now 320070. But again, we're still in draft, and a date and time submitted has not been assigned yet because we've only just saved it. We haven't submitted anything. Now we're going to move down to the first section, resident 1. So resident 1. Right off the bat, it's asking if the resident is a current resident. So if they are, again, the checkbox, if you check it, that means yes. If you leave it blank, that means no. Anything with an asterisk is a mandatory field, so we're going to ask for that information. All right, and then the date of birth, if you notice, a calendar populates. So all you have to do is adjust the year. All right, you can adjust the month, and then select a new date, and it'll auto-populate in the box. Then the gender, also a drop-down. And then facility type or residents receiving services is also a drop-down. Pertinent diagnosis, if you notice, this is one of our text areas, and it's only 1,000 characters. So we're not asking you for a ton of information. We just want to know the diagnosis that's pertinent to the incident at hand. So for example, say the resident has a fall with injury, and there might be some diagnoses that could have contributed to that fall. So maybe they have Parkinson's or an unsteady gait or syncopal episode, okay? So those are things that we would like listed in that box, so something that could have contributed to the incident at hand, all right? Also check if the resident's been transferred to the hospital. So again, it's that checkbox. So if you check yes here, then we need the hospital name. If they haven't been transferred, just leave it blank and skip to the next question. The next question is check if the resident's been discharged. If you check yes, then we are asking for the discharge location. You may not know the discharge location. If you don't, you can write unknown. But we would need something in this box if you're checking yes, they've been discharged. If they haven't been discharged, then just skip down to the next section. The next section is resident 2. You may not need this section if only one resident's involved, but say, for example, there is a resident-to-resident altercation. So if there's a resident-to-resident altercation, you would use a resident 2. So anytime, for example, if there is a resident-to-resident altercation, it's important to remember that both people involved are still residents. They are both vulnerable adults. So in the case of a resident-to-resident altercation, there would be no alleged perpetrator, but if you're filling out for resident 1 and resident 2, resident 1 would be the victim, and resident 2 would be the aggressor. Okay, so again, resident-to-resident altercation, you would use both resident 1, resident 2. Resident 1 is the victim, resident 2 is the aggressor. All right, same information we're asking for in the above residents. So anything that's marked with an asterisk up here, we're going to want you to fill in down here if there is a resident 2. But again, if there is no resident 2, skip right over this section and move on to the next. All right, and the next section we're going to come across is initial reporter. So the first question is, check if the initial reporter and submitter are in fact the same person. So if you are the initial reporter for this incident and you are also the person who is submitting it online in this system, you're logged in as you're making the submission, then yes, you are the same person. You would click that box for yes. You are both the reporter and submitter. And then in that situation, we just want to know your relationship to resident 1. So you are social service. And that's all you have to fill out. If you are both the initial reporter and incident submitter, because you're logged in as we already have your contact information. We don't need any further information. If you are making a report on behalf of someone else, okay, so say the nursing assistant is the initial reporter, they report to you and you're submitting it for them. So in that case, no, the initial reporter and incident submitter are not the same person, and the initial reporter's relationship to resident 1 would be nursing assistant. And then we need their contact information because we don't know who they are because you're logged in as you. Next up, we get to our allegations section. So the allegations have been separated by allegation type, and again, you're just checking the box that you want to check. So if you check a box, it means yes. If you leave a box blank, it means no. You have to select at least one allegation, okay? But you can also select multiple, and in most cases, you can select across allegation types. We'll talk about that a little bit later on, okay? So the first section is sexual abuse, all right? So the options are criminal sexual conduct through the 1st through 5th degree, contact with lack of capacity to consent, maybe unwanted sexual contact. So again, you're just making a selection and moving on. If you need definitions for sexual conduct through the 1st through 5th degree, that is listed in your terms and definitions guide in your Quick Start book, okay? Next up, we have physical abuse, and it gets very specific. So biting, hitting, punching, slapping, kicking, use of manual or physical restraint, use of chemical restraints, unexplained injury falls in here, also criminal sexual assault 1st through 5th degree. We're not asking you to make a degree assignment, you're just picking within the range, okay? And so again, you would make a selection in a box. Say you wanted to select something, maybe you wanted to select something under criminal assault in the 1st through 5th degree and unwanted sexual contact. You could select across those two allegation types, okay? So you can make selections in multiple. Also, the neglect section, I want to draw your attention to resident-to-resident altercation. So if you do have a resident-to-resident altercation, so you've utilized both that resident 1, resident 2, resident 1 being the victim, resident 2 being the aggressor, we want you to select specifically resident-to-resident altercation. You can give us more detail in the incident details section about what happened, but assign it as a resident-to-resident altercation. Also in here, there's another unexplained injury, pain management, elopement falls in here, pressure ulcers, unsafe smoking, okay? Then we also have a section for emotional or mental abuse, so forced separation, any type of communication or punishment would fall in there. And then we've also added a section for self-neglect. Even though there is an option here to report to us, anything on this listing that you would normally report to Mark, you're going to continue to report directly to Mark. All right, so that was the main update that was in the Quick Start user guide, and I'll pull that up so you can see it. So we added a note in the allegations section to please continue to report directly to Mark if the VA is not a facility resident. So for example, a resident's spouse comes to visit and they slip and fall in the hallway. Okay, that is a spouse of a resident, but not a resident. So even though they technically are a vulnerable adult, they're not a resident of your facility. The VA discharges from a facility, maybe they're AMA, and you're concerned about their safety or concerned about self-neglect. So that would be something that you would report directly to Mark, okay? Or the alleged maltreatment occurred prior to facility admission. Also, a side note in the self-neglect section, that if you select anything in self-neglect, you can only select in this section. So if you try to select something in self-neglect, then also maybe in emotional or mental abuse, when you go to submit, you're going to get an error message telling you that you selected in self-neglect. You can only select in self-neglect. So anything that's in this section, you have to stay within that allegation type, okay? And then we also have financial exploitation, non-fiduciary, and fiduciary. So in the incident details section, the first question, did this incident result in a serious injury to the resident, yes or no? So a quick check for yes, leave it blank for no. Did it result in death of the resident? Check for yes, leave blank for no. Description of the injury, okay, so if you answer yes, it did result in injury, what kind of injury was resulted? Broken arm, okay? And then date and time of the incident. When you click in this box, another calendar populates. All right, you can't select a future date, so there are some locks on it to, prevent any data entry errors, but you can select today's date, the day before, and then the time is in military time, and it's a drop-down box, right? It asks to the minute to the second. Obviously, you're probably not going to know down to the second when the incident occurred, and then it auto-populates in the box. Location of the incident is a mandatory field, and the reason for that is, sometimes an incident could happen outside the facility. Maybe there's a day trip to the drugstore, maybe a day trip to, to a casino, to wherever out of the facility, all right? Also, if it happened within the facility, you can get a little bit more specific on where in the facility it occurred. So maybe it happened in the dining room, okay? If it happened at the facility, we don't need the county. We already know where you're located. But if it happened outside the facility, there is a county list here. Also, if it potentially happened out of state, there is an option for out of state as well. And then description of the incident. So in this text area, it will grow with the amount of text that you add. Okay, so it does get bigger. You can cut and paste from a Word document right into this box, but just give us, the quick and fast, concise what happened, what during the incident, what occurred, okay? And then we get to the alleged perpetrator section. So there's enough space to actually add 3 alleged perpetrators. So there's a 2 and a 3, but if you notice, the relationship to resident 1 auto-populates as there is no alleged perpetrator unless you change that. So you don't have to do anything with 2 and 3 if there aren't a 2 and 3, but if there are, you would have to change the drop-down field, and then it would ask you for more information. Okay, but we're really just going to focus on AP1 because all the information for the other 2 are the same. So first and foremost, what is the alleged perpetrator's relationship to resident 1? Are they facility staff, non-facility staff? Again, for a resident-to-resident altercation, you would select there is no alleged perpetrator. Maybe you don't know who the perpetrator is. You would select unknown. So if you're selecting there is no alleged perpetrator or unknown, then you don't have to fill these boxes out. You can move on to the next section because you don't have any of this information. But if you do pick their relationship, then we're going to want to know who that person is, all right? So maybe it was a volunteer. You may not have their middle name. That's okay. First and last, estimated age. We want to know, guesstimate how old the person is, their gender. Again, you might not know their address. You can write unknown if you don't know it. And then check if there's evidence of previous incidents by this alleged perpetrator, yes or no. If you do check yes, then we're asking the nature of those incidents. If there are no, then you can leave this blank. Okay, so this would be another one of those conditional fields. So yes, there was, so I'm going to tell you what. Okay. Again, if there is no AP2, AP3, you can move on to the next section. And then we get to responsible persons. And so this section is if the resident is not responsible for themselves. So maybe they have a guardian, a conservator, or a power of attorney. So in this situation, there is a legal relationship where someone else is responsible for that resident, then we want to know who that person is, okay? Also, if they're working with county case manager already, if you have that information, you have easy access to it, it would be helpful to have it. And additional contact information. This could be a friend, a family member, a neighbor, a spouse, the emergency contact for the resident. You might want to give us that information should you have access to it. And then any referral information. So this is if other entities were involved. So was there suspected criminal activity? Were the police contacted? If so, what type of crime? If you don't know, you can write unknown. Date the police were notified. Again, this is a calendar box that populates. You can't select a future date, but you can select today's date or the day before. Police report number, obviously you may not have that information. If you don't have it, you can write unknown. But if you could supply the name of the police department or the phone number, that would be helpful. Was the medical examiner notified, yes or no? Was the ombudsman notified, yes or no? Was the resident recently sexually assaulted but not yet received an exam? Is the resident at immediate risk of physical assault or sexual assault or abuse? Is the resident believed to be at risk of serious injury? All right, so if you select yes, we believe that they were at risk, but action's been taken to protect them, then we want to know what action was taken to protect them. So again, for example, a resident-to-resident altercation, we believe they were at serious injury, but, you know, action was taken, resident 2 was removed. Okay. And then finally, we get to witness information. There's enough room for 5 witnesses. We know that you might not have any, so they're not mandatory fields. We're just asking for that information should you have it. And then we're done. So at the bottom, you want to make sure, again, update or resave. You'll get that blue bar showing you that it's successfully saved. Make sure you see that bar, and then go ahead and submit to MDH. You're going to get a confirmation affirming that the report's being made in good faith, and to the best of your knowledge, the content is accurate. You're going to hit yes. And then if there's any information missing, you're going to get some error messages. So it's going to tell you, oh, the pertinent diagnosis is missing, so it failed to submit. So if you get this red bar, go find the error, fix it, resave it, so update the incident, and then resubmit it. Okay, so you want to make sure that you're saving before you submit, just in case. All right, so that is incident reporting. Now quickly I'm going to show you, and I know we only have about 10 minutes left, but the investigative report actually doesn't take as long. So to file your investigative report, you need to do your 5-day. Again, you're going to get a notification. So a 5-day report reminder comes out, I think, on day 3. And then again, you'll get an email notification for that e-disposition when incident is closed out. But to find and do your 5-day investigative report, you're going to go to submitted report. So it's going to populate your list of everything that's been submitted. They're in tracking ID. You can put them in order if you'd like, if that's easier to find something. So I'll put mine in ascending order. Okay, so I want to do 320001. And if you notice, this is already, their investigation report status says draft. So someone already started this investigative report, but it hasn't yet been submitted. So if it says draft, it's been started but not submitted. If it says create report, it hasn't been started at all. And if it says submitted here in this column, that means that the investigative report has in fact been submitted to MDH, okay? Also, you want to make sure that before you go to do an investigative report, that there is a submission date and time to MDH showing you that yes, this incident, the initial has been submitted. So now I can work on my investigative report. So there are 2 ways to get to the investigative report. You can find the incident tracking ID number, click on it. It'll take you to the incident report summary page, which again, you have the ability to save, to print. You can print it, a paper copy. You can print it as a PDF, okay? So you can save copies of something. But if you can go and review what was submitted on the initial incident report, and then just click on the button that says investigation report. You're going to note that, oh, that's the incident tracking ID number that I want. I can proceed. You can also go to your submitted reports, and you can go right to the end of the column and click on the button that says either create report or draft, and it'll take you right to that investigation report page. There are 2 ways to get to the report, okay? Just make sure, again, you're confirming that you're reporting on the correct incident tracking ID number, because you might have the same VA involved in a couple of different incidents, so you want to make sure that you're reporting on the correct one. The biggest change to the investigation report is the file upload. So we are asking that you attach a document when you make your investigative report submission. It does say here to send the care plan, but you don't necessarily have to send the care plan. And there are some notes in your Quick Start user guide on things that you might want to submit. So for example, maybe the resident has a fall with injury, but there was a fall assessment done. So maybe you want to send us their fall assessment. Maybe there was a resident-to-resident altercation and one resident has a behavior plan. So maybe you want to send us a copy of that behavior plan, okay? Maybe it's a medication error and you want to send us the medication error report form. So something that you looked at over the course of your investigation that helped you come to the determination that you came to. And even with the care plan, we don't want the full care plan. We don't need the whole, 30 to 70 page document. Just send us the couple of pages that are pertinent to your investigation, okay? So we don't need the whole huge document, just that couple of pages. And the file uploads relatively easy. So if you notice, and this isn't a button, this is just telling you this is where you upload your file. We're taking text files, Microsoft Word documents or PDFs, up to 10 megabytes, all right? So you're going to go to Select Document, click that button. It's going to populate your Documents folder, and then it attaches the file. So you notice it says under Download File, these are the files that have been downloaded. Say I decide, well, this LC Neo is more important than the Paradise Letters, so I want to remove Paradise Letters. So I'm going to go under Remove File, click on Paradise Letters, and it deletes it, okay? So it's going to show you what's been downloaded, and you also have the ability to remove it and upload something else. Okay, again, making sure tracking ID number populates, your facility name will show up along with your health facility ID, and then your investigation status is in draft because you haven't yet submitted anything to MDH. Again, save early, save often, so anytime you make changes prior to submission, you want to make sure you update your report. This has error messages on it, but that won't happen when you do your investigative report. Okay, list of documents reviewed. It's a 1,000-character text area. We just want a quick, short, and sweet list of what you looked at during your investigation. All right, check if the care plan at the time of the incident was followed. So yes, it was. Was it modified to prevent reoccurrence? Yes, it was. If the care plan wasn't followed, what items weren't followed? Well, we clicked yes, it was followed, so we can skip this box here. But if you said no, the care plan wasn't followed, what elements weren't followed? Okay. Does the facility have a policy and procedure for the type of incident reported? Yes, we do. Was it followed at the time of the incident? Yes, it was. Then you can skip this box because the policy and procedure was followed. Let's say, yes, we have a policy and procedure. No, it was not followed. What elements weren't followed? Then fill in that box. Also, if you've made any changes to the policies and procedures based on the incident, what changes were made? One example here that popped up throughout training was we had a facility where an incident occurred that they did not have a policy and procedure in place. So there was a little confusion as to how to fill this section out. So no, they don't have a policy and procedure, so they didn't have a policy and procedure, so it couldn't be followed because it didn't exist. And so she wrote in here, no policy exists. And then here, changes, we are creating a policy. And so that's all she typed in those boxes, okay? Investigation summary, so what you did over the course of your investigation, what conclusion did you come to? Any action taken to prevent reoccurrence to the subjected resident, so resident 1. If there's resident 2, then action taken to prevent occurrence to resident 2. And then this last section, check if the resident was harmed, yes or no, description of the harm. So say there was an injury and you didn't know about it till your investigative report, you could fill that information out here. Check if this was an isolated incident, so yes it was, then you can move on. If it was not an isolated incident, then description of similar incidents that have occurred in the past 6 months, and then a list of people interviewed, all right? So there's sections to write in a bunch of interviewees, but we're only asking for one. So we need you to interview at least one person, give us that information, but there's multiple space to add multiple interviews. And then again, update your investigation report and then submit. Again, you're going to get that affirmation. You're going to click yes. If it doesn't take you to the summary page, that means there's probably errors where you have to go back up and make corrections, save again, and then submit. All right, so once you submit, it should take you to either the incident summary page or the investigative report summary page, where you would then have the ability to print. So if it doesn't take you to this page after submitting an incident report, or it doesn't take you to the investigative report summary page, then that means the submission didn't go through. Another way, again, to check is go to your submitted reports. For initials, make sure it assigned at a date and time. For investigation, make sure this turns to submitted in this last column. All right, so that is the new system.